Senator Sasslaw, Senator Newman,
Here.
Senator Edwards, Senator Lewis, Senator Donovan, Senator Suderline, Senator Barker. Mr. Chair, you have a quorum.
We'll have Senator Kiggins presenting her bill now.
Good morning, Mr. Chair. Good morning, committee. I'm going to present the bill virtually today. The other day I had the honor to begin to present the bill, but we were cut short, so I'm going to reiterate some of my opening statements. I'm here today to present the bill about nursing home staffing ratios, Senate Bill 1149. I'd like to start out reading the opening paragraph of the newspaper from last year, January 29th, the day after my similar nursing home staffing ratio bill was heard in the same committee last year. To quote the Daily Press, brushing off for the 16th time a proposal to set minimum staff levels for Virginia's nursing homes, which are ranked among the nation's worst for the number of patients per caregiver, a state Senate panel decided to recommend a study group instead. I sat on that study group, as did many of the voices we will hear from today, for many months over the summer. We discussed solutions to nursing home staffing recruitment and retention and came up with 35 recommendations, 3 of which I proposed as bills this session, and the 4th which brings us here today, staffing ratios. I also sat on the governor's long-term care task force since the beginning of the pandemic, which focused on addressing PPE shortages, testing deficiencies, staffing shortages, and now vaccine distribution. The issue of inadequate staffing has been at the forefront of many meetings, discussions, media stories, and constituent emails for almost a year now. Last year, almost 3 months after my bill was turned into a study, we saw over 50 deaths in one nursing home in Henrico County occur over a 2-month period where the medical director, Dr. Jim Wright, who we will hear from today, was faced with staffing shortages that caused he and his physician wife, who did not work at the facility, to take up daily care and feeding of residents due to staff who could not keep up with the needs of patients or who could not come to work because of their own health. Many of these same staff work at multiple facilities to make ends meet for their families due to low pay and extremely tough work demands. Dr. Wright would end up on the national news speaking as a subject matter expert on a subject he didn't want to be an expert in. In addition to New York, Virginia has boasted some of the highest percentages in our nursing facilities throughout the course of the COVID pandemic. As of today, there have been 840 COVID outbreaks in our long-term care facilities, 27,000 cases in long-term care out of 55,000, and deaths at number 3,000 out of 6,000 total in Virginia, so almost 50%. 4% of our population lives in nursing homes, but over 40% of our deaths from COVID have occurred there. Here we are for the 17th year in a row talking about the same thing, hearing from some of the same but some new voices of frustrated families, caregivers, and patient advocates who speak for our most vulnerable Virginians who oftentimes cannot speak for themselves. This bill simply establishes staffing ratios, which are listed in the bill, but just to review, it sets up based on the time of day, so day, evening, and nighttime. This was a compilation of, we looked at all 50 states and what they were doing for staffing ratios. 30 out of 50 states currently have some sort of staffing ratios in place. In addition, this bill also adds a background check requirement to renew the background check after 5 years of employment, initial employment, and an annual training requirement for first aid, medication administration, infection control, and facility compliance. Those things are the same as last year's bill. To make this bill more amenable to the industry folks who I know you have all heard from, who oppose this bill and this idea, we've added an enactment clause after discussion with the Executive Director of the Joint Commission on Healthcare, Jeff Lenardi. As we know, there will be a Joint Commission Healthcare study already planned to be conducted and findings available December 31st, 2021. Staffing ratio is not a new concept. Like I said, there are 30 out of our 50 states that currently have some sort of staffing ratios in place, many with more strict requirements than the one presented here. What will Virginia do to ensure we provide the quality care our greatest generation deserves? We turn this issue into yet another work study, and I come before you then again this time next year for the 18th year in a row, asking for improved staffing for our most vulnerable Virginians. It's time to make a difference, to learn from our mistakes into Virginia, to devote funding for making our long-term care facilities better places to finish the last years of life, and to fix this inadequate staffing problem, not just continue to study it. And I encourage you all to support Senate Bill 1149. But first, I'd like to introduce some of my speakers to speak in support.
All right. Are there any questions of Senator Kiggins? All right. Then let's hear from the first speakers.
I'd like to introduce Dr. Jim Wright first.
Good morning, everyone. Thank you, Senator Kiggins, and thank you for the honor of speaking to the subcommittee this morning, everyone. Yes, Senator Kiggins introduced me as a physician who you may know as the medical director of Canterbury Rehab. We were the first facility to have an outbreak in Virginia, and really one of the worst outbreaks in the country at the time. And so I know more than I really want to know about coronavirus and the effects of understaffing on our nursing homes. I must say that along with Senator Kiggins, I was very hopeful that this year this bill would pass. I have studied the bill and studied the data surrounding understaffing in nursing homes. And the thing is, we know, as we have known for the past 17 years, that understaffing leads to poor quality. Studies that have been sent to Congress, and in fact, most recently, a study by the MITRE Corporation echoed these same results. Understaffing leads to poor quality. We know this. Poor quality means bed sores, malnutrition, increased infections. What we know, however, from the data that's been presented over the past 10 months from the COVID epidemic, is that understaffing leads to increased COVID presence in nursing homes. So nursing homes that had poorly staffed or were understaffed traditionally, like Canterbury Rehab was, found that they had a much higher incidence of COVID and therefore many more deaths. And so now we know that understaffing simply is not a question of poor quality care. Understaffing is a matter of life and death for our seniors. And so with this knowledge, I feel that it is urgent and it's clear that our efforts to simply require minimum care for our elders must pass this year. And the bill is not a punishment. And I, having worked in long-term care for 25 years, I'm not into punishing nursing homes. I'm into helping them be the best they can be. That's what I do. And all this is simply saying, we know what it takes to give good care for our elders. We know what it takes to prevent unnecessary deaths for our elders. This bill is simply saying, let's establish that in Virginia, like most other states in the country. And it's simply saying to the industry, and I understand that we undercut and underpay long-term care in this state, but it's saying to the industry, your current business plan depends on poor quality care. It also depends on unnecessary deaths. If we were to have another pandemic, we cannot allow this type of business plan to continue. We're simply saying this is the kind of business plan that you will have to implement in Virginia if you are to take care of our elders. That's all it's saying. So I'm asking you, along with my fellow nurses and CNAs and other doctors, and especially the most important stakeholders in all of this, our elders, I'm asking for your consideration in passing Senate Bill 1149. Thank you very much.
All right, are there any questions? All right, there are additional speakers? Okay.
If you would like to speak in support of the bill, please raise your hand. Joe Musso, you'll be our first speaker. Please unmute yourself. Joe Musso.
Good morning. Good morning, and thank you, Senator Kiggins, for having me speak here on behalf of your bill today, and thank the committee for hearing me as well. My name is Joe Musso, and I am the current chair of Ashcraft and Jarrell's Elder Abuse Litigation Group. I am also a past chair of the Virginia Trial Lawyers Long-Term Care Litigation Section. I'm testifying today in support of Senate Bill 1149. And in particular, paragraphs 29 through 31, which set forth minimum staffing and training standards for nursing homes. I've been a nursing home abuse litigator for 23 years. I have seen every conceivable way that short staffing and poor training can maim or kill a frail, vulnerable elderly resident in a nursing home, and that's before COVID and the horrible scourge that that's been. I've seen massive gaping infected pressure wounds from being left unattended for days. I've seen emaciated residents who weren't fed. I've seen beatings and rapes. I've seen cover-ups and false charting. But mostly, over 23 years of doing nothing but prosecuting abuse and neglect day in and day out, what I see is good-hearted nurses and aides doing the best they can in a situation where profit is leading directly to abuse and neglect being guaranteed. And I don't begrudge nursing home businesses making a profit, by the way. They should. Their financial stability is a necessary pillar of good care. The reality, however, is that the nursing home business is like many businesses in some ways and is a very unique business in others. Staffing problems in the business world are all too common. We've all seen businesses that are failing because ownership is not staffing the business effectively. Maybe we've had a long wait at a restaurant, the food might come out cold, the order is wrong, adjacent tables might be unbussed and dirty. Maybe you've stood on a seemingly eternal line at a grocery store and wondered and muttered under your breath, why is there only one register open on a Saturday at noon? More recently, in the age of online ordering, maybe you've been told to pick up your food at 7 o'clock and you get there and it's not ready till 8:15. Understaffing is a common source of poor delivery of services and goods in business, is my point. And there's a great reason for that. Every business is trying to staff to a level where they can still deliver their services without having people sitting around doing nothing and getting paid for it, because overstaffing is a profit-killing waste. But I assure you, with 23 years of experience behind me, that this common business dilemma of staffing for profit optimization has a very unique impact on this particular business. Because the result of understaffing in this business is not a cold meal and a nasty Yelp review for a restaurant, or customers never returning to a convenience store whose lines are too long. In this particular business, the most vulnerable citizens in our nation, our grandparents, our parents, our siblings, our loved ones, they lay in their own waste as their skin slowly breaks down into a softball-sized crater, exposing their bones and organs until their own feces leaks into the wound, overcomes their system, and kills them slowly, painfully, agonizingly, to the last breath. I see that scenario every single day. It's fractured skulls and broken necks from repeated falls.
Could you try to finish up quickly here? We got a couple of more speakers as well.
Of course, of course. Study after study has shown us what we all know instinctively. Better trained, higher quantity of nursing home staff leads to better care and less negative outcomes. But we also know what decades has shown us time and time again is that a profit-motivated nursing home will staff in accordance with their financial interests. Virginia is 44th in staffing in the country. We can do better than this. Turnover is not an excuse for fighting off this bill. Turnover is the result of understaffing, not a justification for it. Thank you very much for your time today. I really appreciate it.
All right, thank you. We do have several more speakers, so we'll have each one 2-minute limit on each of the rest of the speakers.
Understood.
Jeremy Kellums, please go ahead.
Good morning. I'm Jeremy Kellums. I'm a nurse practitioner. Thanks for letting me speak today. I'll be brief. I do want to echo Dr. Wright's message. When you've been in long-term care for quite a while, licensed practical nurses may have 20 to 30 patients a day, and that's their normal staffing pattern. If there's a call-in, they may have 45 to 50 patients. I mean, you cannot render quality care, in that setting. Certified nurses aides standard may have 8 to 20 patients a day is their normal staffing pattern. If somebody calls in, they could have 20 to 30. So this bill is desperately needed. And then registered nurses may not even be in the building. They are typically only in management, not on the front line. And so you lose that bachelor level degree that is not at the bedside at all. But I'm highly in support of this bill, and thanks for allowing me to speak.
All right, thank you.
Deborah Taylor, please go ahead.
Mr. Chair and members of the committee, my name is Debbie Taylor. I am representing AARP Virginia. We support SB 1149 and thank Senator Keegans for her leadership on this issue. While AARP Virginia does support this bill, we urge the GA to raise the minimum staffing ratios in the bill to be in line with CMS minimums. AARP Virginia thanks the General Assembly for adding infection control to the list of training items, as well as requiring the board to establish an administrative process before any exemption can be applied. Thank you.
Thank you. Next.
Jeremiah Manson, please go ahead.
Yeah, my name is Jeremiah Manson. I'm 31 years old. I'm a bilateral amputee. I only have the use of one arm, and I'm actually a resident of the long-term care facility. And I know that you guys think that most people in nursing homes are old in 80s and 90s and have dementia, but it's actually not true. There are a lot of people who are closer to my age who can't live at home because we require more care. And a big problem that I've had is not being turned every 2 hours, as the law dictates, because of the understaffing. And they've also removed the bed railings in my facility, which makes it impossible for me to be able to turn myself because I don't have any trunk muscles, which prohibits my ability to move around enough. And it just leaves me having to catch up, trying to fight and heal bed sores, and which has just been a constant issue for me in my life. I've found that while serving meals, that there, because of the understaffing, that there are very few, if anyone, available to answer call lights, and often when you push the call lights, it takes about maybe an hour or even more sometimes to answer it, and it could be something for as little as getting a cup of water, or for me, almost falling out of bed, because they put a lot of arbitrary doctrine into the facility, trying to stave off one problem but creating another. And I've also had a problem with COVID breaches in this facility. When I went out to the hospital back at the beginning of January, and I came back, I had to go into basically a mandatory 2-week quarantine down on the quarantine unit. And basically they were so understaffed that there was a dementia patient who was allowed to escape the quarantine zone, who was COVID positive almost a dozen times a day because they couldn't assign a sitter to him, which is who they usually have when it comes to dementia patients who have a tendency to wander. But he even came into my room. He was touching all my things, and the CNA who came in to get him out of my room actually was more concerned about clocking out because it was at the end of the shift, and she refused to clean off all the things that he was touching in my room. And
all right, could you try to wrap up, please? We got other speakers too.
Just the problem with the I support the bill, and I know that those who make these bills are responsible for our quality of life, and we're not just faceless individuals. I'm a real person, and will continue to suffer if you fail to properly create realistic laws that benefit me instead of what the lobbyists for the facility desire. I need these laws affect real lives, not just faceless individuals. And I need you to, when you consider these laws and you consider passing this bill, just know that you need to think of it as passing a law or a bill for someone you love, for your loved ones, or for yourself, because many people will end up in these facilities, and just because you're not dealing with the outcome and the situation at hand in the current time, you need to look further down the line, and so that we all may be have decent, have a quality of life that's worth living. All right, thank you.
Thank you for speaking with us here. Next.
Bob Kukic, please go ahead.
Hi, thank you for your time. My name is Bob Kukic. I'm a member of Dignity for the Aged, and I am in support of Bill 1149. You already know all the facts supporting this bill, so rather than repeat them, let me just get to the heart of the matter. The dangers of understaffing in our nursing homes has been common knowledge since the 1980s. Today, we have government studies that document minimum staffing levels, and yet the heavy workload imposed upon our healthcare providers and the inadequate level of care provided to residents remains unchanged. For 17 years, this committee and this General Assembly have been asked and failed to correct these conditions by passing legislation similar to this bill. For 17 years and more, nursing home owners and lobbyists have been very effective in thwarting change here in Virginia. But today, you once again have the opportunity to do the right thing. Today, you can forward Bill 1149 to the General Assembly and ask that your colleagues support it. In so doing, you will establish that residents receive the level of care they require and that our healthcare providers are not given unreasonable work demands. One final thought. For 6 years, my wife and I moved my mother from nursing home to nursing home, 5 in all, trying to find one that would adequately provide for her needs. In the end, we found a private payer home where the ratio of healthcare to resident was in line with this bill. In that home, the healthcare providers were given reasonable work demands, which they accomplished in a professional and friendly manner, and my mother was afforded the level of care she required, allowing her to live her final days with dignity. All I ask is that you support this bill, ensuring our healthcare providers are given reasonable workloads and residents can be afforded the level of care they require. Thank you for your time and for doing the right thing.
Thank you. Next.
Emily Hardy, please go ahead.
Good morning, Chair and members of the committee. My name is Emily Hardy, and I'm an elder law attorney with Virginia Poverty Law Center. It is a nursing home's obligation under contract and federal law to provide adequate staffing. This bill is merely seeking to define what that means. As others have said, the nursing home care hours in Virginia are 44th in the nation. Virginia additionally has one of the highest levels of medical criteria in the country for admission to nursing homes. This means that nursing home residents in Virginia have much higher health needs than residents in other states. This justifies higher staffing. So in Virginia, we have less staffing for sicker people. We no longer need to imagine what this means. COVID-19 has shown that this inadequate level of staffing leads to disastrous results. According to the New York Times, residents in Virginia nursing homes account for 48% of the deaths in Virginia, which is 33% higher than the national average. Nursing homes have complained in testimony that they can't find people to hire to meet the staffing requirements. While it's true that working in nursing homes is difficult, the industry's excuse rings hollow. And even more important, their excuse in no way justifies maintaining the dangerous levels of staffing and the status quo. Substantial funds are being paid to nursing homes today, even more so during the pandemic. And this bill will bring additional dollars to support the increased staffing. Other states have figured out how to fund, hire, train, and employ adequate staff, and Virginia can too. The answer to this urgent crisis is not to let more residents suffer and die while yet another study occurs. This bill is a vehicle to finally move the needle and protect the most vulnerable and most disabled Virginians. Our nursing home residents rely on us to make sure they are safe and cared for. And right now, Virginia is failing. We thank the senator for bringing this bill, and we urge you to pass these needed first steps. Thank you.
Thank you. Next.
Arleta Diggs, please go ahead.
Good morning. I'm here in favor of the bill. My name is Dr. Arleta Diggs. I'm a family medicine physician who has been practicing for over 20 years, and over the past 4 years has been practicing exclusively in skilled nursing facilities and long-term care facilities. I represent both ends of the spectrum in the sense that one facility I have has all the issues with staffing, and the other facility that I have adheres to a different standard of staffing, and the difference in the care is astounding. It is astounding that those who are private pay, who can afford to pay thousands of dollars out of their pocket, not with insurance, every month, are a healthier population as a whole. I do not see the bed sores. I do not see the rampant infections. It is a whole different world than the other facility I am, which does not have any of those same restrictions. And as Jeremy said, it is common that if someone calls out, you may have one person managing 40 or 50 people. I think sometimes for those who don't work in elder care, it's sort of hard to imagine what that looks like. But all of us pretty much have had children or have had exposure to children. And I myself have too. I can think of when I've had a stomach virus go through our house and I'm trying to manage just 2 children who are incontinent and who are upset and who require me 24 hours a day. It's extremely difficult. Now imagine that you don't have 2, imagine that you have 25 who are all incontinent, who are all upset, and they're not 20 pounds, they're 200 pounds, and you are not 200 pounds. Imagine that going on all day, on top of you're supposed to give medications, you're supposed to feed them, you're supposed to clean them. And then for those patients that have mobility issues, you're supposed to turn them every 2 hours. It is absolutely overwhelming. And it is a shame that for whatever reason, we're not putting the same value on our elders that we would put easily on children. I worked in the daycare system prior to becoming in medicine, and there were all sorts, everybody understood, oh, the kids need this level of care. I don't understand why it doesn't translate into the elders also. Thank you.
Thank you. Next speaker.
Sam Kukic, please go ahead. Please unmute yourself.
Okay, sorry about that. I'm the director of an organization called Dignity for the Aged. And I started this organization because my mother-in-law was abused and neglected in a nursing home, resulting in 2 black eyes, a large abrasion to her head, 55 falls, and she lost 65 pounds, which is shocking, isn't it? She was on the front page of the Richmond Times-Dispatch, the Daily Press, and even the 6 o'clock news. So you see, it isn't a secret. People know what's been going on in nursing homes for quite a while due to understaffing. At first, I was angry at the staff, but then I realized that the staff are suffering from burnout, so they leave. They earn $10 an hour and they have 20, 30 or more residents, which is impossible. I presented this information last year to this committee, and I even participated in work group 392 to help find a solution to the terrible conditions our elderly are being subjected to. What a waste of my time, listening to a 3-hour long presentations and recommendations to hire the deaf, the blind, felons, and people who have difficulty being hired to take care of our elderly. So we haven't passed a bill in 17 years. How many years must we wait? How many more people have to die? The answers have been presented over and over again. Nursing homes are becoming a front. They don't provide care. They just collect money at the expense of the elderly. Even this current bill, 1149, kind of lacks the guarantee for anyone existing in a long-term facility, including the old, the young, and even children are in these facilities, in that all bets are off with respect to establishing ratios if there is an epidemic, which is what we have right now. So that being said, do we just let them die until COVID is over? So tell me, please, why is it so difficult to pass a bill to establish ratios? We have tons of documentation, statistics, reports stating that residents are receiving less than 2 hours of care a day. Maybe we need to take another approach. Maybe you should take time to experience what it's like to live in a nursing home. Allow someone to wake you up at 4 a.m. for a shower. Push a call button and have nobody answer. Relieve yourself in a diaper and sit there for hours while your skin starts to deteriorate, and then you start smelling. And to be honest, this whole situation stinks. Can we please stop playing political games and start taking care of people who earned you your freedom with their blood, sweat, and tears? This is criminal behavior to allow residents to be abused, neglected, and die when you have the power and responsibility to protect them. It is illegal in the state of Virginia to mistreat a dog. But nursing home residents are dying like flies, and the laws that should be there to protect them don't exist. So when you will reflect upon your decision on whether to pass this bill, please, please think of these helpless people who served their country in war, taught your children, provided a foundation for this country to be one of the greatest nations in the world. You have an opportunity to say thank you with your actions.
Thank you. Next.
Joni Latimer, please go ahead.
3. Okay.
Joni Latimer, please unmute yourself.
Good morning, committee and Senator Kiggins, and thank you very much, Senator Kiggins, for your leadership on this bill. I'm going to be as brief as possible because I do believe that the most important voices we're hearing from this morning are the residents and family members, and I'll just simply affirm much of what has been said. Certainly, Dr. Wright covered a lot of the underlying issues that we're all aware of, and I won't repeat those, but I will simply say I represent the Ombudsman program, and I can say from years of watching what occurs when there just aren't enough staff that happens in far too many of our facilities on far too many days, and there are just not enough staff to meet the basic care needs of residents. I think you've heard from residents and families what the results of that are in very graphic terms. We do know Virginia is one of a minority of states that has not taken the step to pass a specific standard. We're still dealing with a standard of quote unquote adequate staff, which really hamstrings our licensing folks in trying to ensure that problems are corrected. We are in national statistics 38th in overall hours of resident care and 44th in RN care, which is so critical, quality and oversight. And I will simply say that ombudsmen every day, day to day, see the tragic effects of serious and life-threatening health complications and decline among residents, things that could have been prevented, unnecessary injuries and hospitalizations, and just the indignities and the suffering when a resident is simply not assisted to go to the bathroom or to eat or drink. No one intends this. This bill is not a punishment. This is an insurance against that kind of suffering. This is just what happens when there are not enough staff to meet basic care needs. So we do, I believe, need a clear and enforceable standard to protect our most vulnerable citizens. And I think Senator Kiggins has presented here a doable
wrap it up quickly, please?
Yes, sir. Doable way to do the right thing. The costs are there. I think we can deal with those, but I believe this is the Commonwealth that is committed to dealing with the challenges and moving through to do the right thing. It's not it would be nice if we could bill. This is people will die if we don't bill, and I appreciate your support and trust that you will help us move it forward. Thank you.
All right, thank you. Next.
Susan Hines, please go ahead.
Good morning. My name is Susan Hines. I'm a member of Dignity for the Aged. I'm also a cellist and a string teacher in Williamsburg, James City County Schools, and I'm actually sorry that I feel the need to speak today. After 17 years of this discussion on ratios, I would think that bright people like our delegates would have an answer to staffing. This is not political. Both parties are guilty. We claim to be so progressive here in Virginia, and yet North Dakota has us beat by a mile. North Dakota, do you know why? They have mandated 3.96 hours of care for each of their residents. For some unknown reason, we won't do that here in Virginia. Why do each of you have an aide? Why can't we just have one aide for all of you? Why does your favorite restaurant have more than one server? Why do we have so many police officers? Why do we have ratios of teachers to students? I think we all know the answer to these questions. I served on that work group in 2020 that studied these issues of long-term care. It was one of the most frustrating experiences of my 67 years. We talked around and around and around the real issue of people dying of infections, abused and neglected in massive numbers due to low staffing. It's a no-brainer, and this has nothing to do with COVID. This is happening every year. Is this simply protecting the owner's bottom line? I don't understand. After 17 years of discussing ratios, I wonder how many Virginians have died of just infection. I can tell you how many died in 2019 in the United States due to just infection, 380,000. Let's just let that sink in a minute. Fortunately, most of you won't ever have to live in one of these places, but I would like to suggest that we all go stay in one of our one-star facilities for a week. I'll even take a week of sick leave to do it with you. I don't think we would have to talk about staffing anymore. We would act. Please, I am begging you to act.
Thank you.
Thank you.
And our final speaker, Lionel DeCure, please go ahead.
Yes, can you hear me?
Yes.
My name is Lionel DeCure, a member of Dignity for the Aged. Right now, as I speak, there are hundreds of our seniors laying in their own waste for hours. Yes, I said hours, because there are not enough certified nursing assistants to change them. I know this because my wife had to wait 6 hours. Many of our seniors have undiagnosed UTIs because our nurses are understaffed and do not have the proper time to diagnose their residents. Many will become septic and die. Many of our seniors are developing bed sores. Why? Not enough staff to rotate them. I know my wife wasn't able to be rotated because the staff wasn't there, or not enough staff to feed them so they'll get proper nourishment for their skin. Many are falling. Why? Not enough staff to watch over them to keep them from falling. Why are those in power not making these changes to help our seniors? Why? Or is it because some of those in power are being bought off by the lobbyists working for those in the industry to put profit over the lives of our loved ones? Or could it be that there are some of those in powers being controlled by a few individuals that make the decisions, that are controlled by large equity investors that are putting profit over the care and lives of our seniors? Is it those in power? Some of them just don't even care, or you know, they just don't care. All that seems to happen is that another work group is formed. I also served on that committee and couldn't believe what I heard, that the solution is to come up with people that are blind or deaf to serve as CNAs. All that happens is another work group, and more work groups. The problem is that there's not enough staff in nursing homes to give our loved ones the care that they need. Lack of care results in harm, in injury, and even death to our seniors. Take action.
Thank you. All right, we've heard from all the speakers now. Okay. Are there any questions or comments anyone wants to make at this time?
Yeah, Mr. Chairman.
Yes, Senator Edwards.
I know a little bit about this issue. The problem is Medicaid funding. We need to get the Medicaid funding up. 70% of Medicaid goes to nursing homes, but we're not paying them anywhere near enough. To give you an example, I chaired the board of Virginia Lutheran Homes. I was on the board for 20 years, and for 12 years I was the chair. At the time, we built the Brandon Oaks Life Care Retirement Community around a nursing home. And the constant complaint was, that I always passed on to the CEO, we don't have enough staff, especially on weekends. He said, that's right. We don't have the money. Can't afford it. Give you a little bit more example. Up in 1980, you could run a 100% nursing home and actually have enough money to fix the roofs and so forth and so on. By 1990, you had to have about 30% private pay that pay a lot more than Medicaid would pay. And by 1995 or so, it was about 50-50. The problem has always been Medicaid doesn't pay the freight as it should. I would like to know something that somebody made a comment, we do not meet the CMS standards. I'd like to know what those standards are and where are we on this and why don't we meet the CMS standards? I would assume CMS would enforce those standards. Can somebody answer those questions?
I don't know whether there's anyone here who could answer that question.
Senators, this is Dr. Wright. I'm familiar with the CMS standards. They have a minimum requirement for nursing homes. They do not have ratios that they have put into law. They simply say nursing homes have to have enough staff to provide adequate care. They have received multiple reports on those ratios below which patient harm occurs, and that those ratios are echoed in Senator Kagan's bill. That is not CMS or federal law, however.
Does anybody know where we stand in terms of other states in terms of ratios?
I think there were a couple of the speakers commented, I think one on overall hours per patient caregivers, I think was said that Virginia was 38th, and another said that on nursing hours it was 44th. Senator Newman.
Mr. Chairman, first off, I want to apologize for Senator Kagan's. We did not take up her bill last time, and I personally apologize for that. I would tell you that what's occurred today is very helpful and functional, but it also demonstrates why I think this bill came to subcommittee in the first place. It's very, very, very complex. The fact is that this bill was supposed to be in this subcommittee, then because of a censure item, I think, on the floor, the subcommittee could not meet that night, and then of course we had the full committee. There was a discrepancy about whether or not it should have been on the docket, and but I'm glad we brought it to subcommittee because I think we had the opportunity to spend 45 minutes or more in educating the members. Mr. Chairman, a couple of things. One, I'm grateful for the testimony. I do think it is helpful just to say that, at least in my area, maybe it's the only area, but we do have some very good nursing homes as well. Some ones that love Virginians and otherwise. I would hate for anyone to walk away from this and think that one, abuse is condoned, allowed, or in any way encouraged in Virginia. It's not. There's criminal behavior. There's action that takes place. When it comes to the standards, I know there's been a lot of work groups, and I imagine what we're going to do is continue to work on this item, and I personally kind of like some of the criminal background check items that are in Senator Kagan's bills as well. But I think one of the things we're going to have to do is we're going to have to ante up, and we have to ante up beyond the $33 million that's in this bill. I think we're going to have to look at staffing availability and make some determinations whether or not this Commonwealth is going to invest much greater in staffing and staffing education. To do this now when there's not staffing that's currently available would be very difficult because you simply can't hire it. I've got a nursing home in my area. It's top-notch, and they have actually produced their own school, and all they do in that school is teach more people to be their employees. So I appreciate Senator Kagan's bringing this to us. I believe that the HHR Subcommittee of Finance has probably got to look at this, not just on the $33 million, $17 million federal, $15 million for the state money. I think we've got to look at it at a much bigger area. How do we ensure the operators have access to the individuals through education? And then two, what do we do to make them to where they are somewhat capable of remaining in business and have some degree of profitability beyond just the Medicaid reimbursement? That may be $100 million. It may be more, but I think Senator Kagan's and others have indicated that the item is very, very, very important. So, Mr. Chairman, that's just my thoughts.
Can't hear you.
I'm sorry, I didn't hit the button here. Someone here who can respond to the issues related to regulations and staffing with the Department of Health. Ms. Beasley, I think, is on the phone, so can she come on?
Good morning. Can you hear me?
Yes, yes, thank you.
This is Kim Beasley with the Department of Health. Just to respond to the earlier question about CMS required staffing, and Dr. Wright provided an accurate response. There are currently no CMS requirements for staffing ratios in nursing homes.
All right, thank you.
Mr. Chairman,
Yes,
question.
Senator Edwards.
Yeah, where do we stand in terms of ratios with other states? Does anybody know this?
Yeah, that was I think what some of the speakers were testifying to, a comparison with other states.
Yeah.
And I think overall it was 38th that we were in terms of the number of hours of caregivers, which would include, I guess, nurses, aides.
Can the speaker elaborate a little further on this? The last speaker?
The last speaker, she works for the Department of Health.
Well, she may know the answer. I don't know.
Do you, Ms. Beasley, do you know whether how we compare to other states?
That's the information that's already been spoken to. That's what's posted on the CMS website on the comparison.
Can you tell us what it is? I don't have the website in front of me right now. Just tell me what it says.
I believe the information reported, I believe, was that we were 38 for staffing.
Right.
What does that mean in terms of hours and all the rest? Can you elaborate a little further?
Well, CMS collects staffing information from nursing homes on a monthly basis, and they compare that information that's reported against the other nursing homes across the country.
Can you give me some specifics?
As far as, I'm not sure I understand what you're asking.
Well, I'm asking specifically, what are the hours compared? Give me some numbers. How many hours do some states have? How much do we have? We're 38. Okay, that doesn't tell me but so much.
I don't have that information in front of me, but I'm happy to provide it.
Can you provide it, please? Thank you.
Yes, sir.
We can
Mr.
get
Chair.
that information. Generally, it's around 3 to 3.5 or 4 hours per day that residents receive in terms of the ratio of caregivers in the nursing home units to the number of patients that are there. So,
Mr. Chair?
Yes.
We
Senator
have,
Kagan.
as part of the work study that we were in this past summer, we did put together we have an appendix that goes through all 50 states and delineates if it's a staffing rate, if they use staffing ratios or if they use minimum direct care hours, because there's two ways to do it. And Delegate Watts from the House, hers was direct care hours, whereas mine is staffing ratios. And different states are different and they do it different ways. So I'd be happy to share with the committee just the spreadsheet that we have of all 50 states and what each does.
All right.
That'd be helpful. Thanks.
Thank you. All right. Any other comments on things? I think just to summarize a couple of the comments that have already been made and some of the things I think that are relevant here. Clearly, if we're going to end up doing these types of ratios and having required levels, we're going to have to figure out how many staff would be appropriate, what types of variation there would be in the needs of different patients, so that you don't set a standard that is appropriate for one facility with the patients they have, but not appropriate for another facility. And I think that a lot of the issue is directly related to what Senator Edwards has referred to and Senator Newman in terms of the Medicaid reimbursement. Medicaid reimbursement really drives nursing home care because roughly 2/3, 70% of the patients in Virginia, at least part of the cost of their care is provided by Medicaid, and Medicaid only pays up to a certain level. That level is actually less than what it actually costs to care in the average nursing home in Virginia. With the current staffing levels and the current salary levels, both of which are questionable. So that I think, right now, a nursing home is in a situation where as long as they're trying to take care of all the patients that are there, including the Medicaid patients, they're going to have to get enough private pay patients to be able to offset some of the losses they have with the Medicaid patients. And there are some facilities that are 80 and 90% Medicaid patients. So it's a very serious challenge there. So what it does is it limits their ability to hire large numbers of staff. It also limits their ability to pay well, and nurses and nursing aides and others working in nursing homes generally make significantly less than what they do in the hospital settings and others. So it's not as if, you know, the operators of the nursing homes are pocketing a huge amount of money and intentionally trying to shortchange the staff in terms of their salaries or in terms of the number of staff that are there. They're trying to operate within the reimbursement rates that we have provided. This past year during the pandemic and continuing now, we have given a bonus to all nursing home patients of $20 per day to be able to take care of the patients that are there. And that clearly has taken some of the pressure off on these types of things. But you know, there's clearly still a significant number of patients that, you know, a significant number of issues that are there. This issue has actually not been studied by the Joint Commission on Healthcare in probably more than a quarter of a century. But already, just in the last few months, the Joint Commission on Healthcare members voted to make this the top priority in terms of what to look at in 2021. So we did 3 different types of things. Senator Kiggins, Senator Edwards, and Senator Donovan and myself are all members of the Joint Commission on Healthcare. So there are a number of people on this subcommittee that are working on, will be working on that issue. So I think we are in a position to move forward to be able to get good standards and consideration of what it would cost to be able to do that. And I think it was Senator Newman made reference to the $33 million per year that would be required just to be able to meet the cost of these standards with the current salary levels and with no other additional staff that might be necessary to be able to deal with some of the patients they have. So it's going to be a challenge, but it's something that I think the Joint Commission on Healthcare is ready to take on, and certainly Senator Kiggins will be one of the voices in that process there. So are there any other questions anybody has on anything or comments? Senator Kiggins, did you want to wrap up on things?
Yes, thank you, Mr. Chair. And thank you for your words, and as well as Senator Edwards and Senator Newman. And I ask that we just consider, you talk about the funding piece, and that's certainly an important component of this, but how will that funding then translate into our staff? And I'm just leery and want to make sure that we understand that not just going to the facilities, but the entirety of the work group was spent on nurse recruitment and retention. And I think, and I've heard the Senator from Bedford speak before just about the shortage of nurses. So if we can't translate into better pay and better working conditions for our staff, then we're not going to be able to achieve the goal that we all have of better staffing for our nursing homes. So just asking that we put some safeguards in place to ensure it's our hardworking nurses. Working in a nursing home is hard work. I've worked in nursing homes longer than I've been with you all in the state Senate. So just personal testament to the care and the hours and how heart-wrenching it is to not be able to spend the time that you want to spend with each and every patient. And I think the people that have spoken here today, just thank you so much for being advocates and for continuing to be noisy advocates and for working with our crazy schedule and virtual environment. But it's your voices that are most important. So thank you for that. And thank you to the committee for listening and for taking time and just understanding the serious.
Oh no, she's frozen. So. Oh. Okay, see if she can reconnect. Right.
Mr. Chairman.
Yes, Senator Newman.
While we're waiting for the senator to come back, clearly I think that the senator spent a lot of time on the bill, and I would hope that at the very least that the bill could be sent to the Joint Commission as a framework for them to consider as they move forward, because it's taken a lot of work to get this bill, and it would be interesting to have them take a look at the bill as well. And so I would, if you're okay with it, sir, move that the subcommittee recommend that the bill go to the Joint Commission on Health Care under a letter from the chair.
All right. Is there a second to that motion? Any discussion? All in favor, say aye. Aye. Oh, we've got a roll call vote on this, so.
Senator Sasslaw, Senator Newman, Senator Edwards, Senator Lewis, Senator Suderline, Senator Barker.
Aye.
3, 4,
All right.
6 ayes, 0 nays.
All right, thank you. We are adjourned. Thank you. Thank you. And I didn't see you come in, so. You may probably hear more.